I am Kirk Jowers, and welcome to the April 2nd COVID-19 episode. As always, I'm joined by Dr. Russell Osgothorpe, the Chief Medical Officer of dōTERRA and a board-certified infectious disease specialist. Let's look at today's graphic from the World Health Organization. There are now 896,000 confirmed cases, 45,526 deaths, 205 countries with cases. This is a little bit longer of a COVID-19 update for April 2nd because we have the weekend and a couple of extra days, but it can best be summed up by the UN Secretary General saying that the coronavirus poses the gravest threat to humanity since World War II. Unfortunately, there is plenty to support his position. To name just a few, the White House released a grim projection this week saying that the pandemic could sicken over 1 million people and kill between 100,000 and 240,000 in the United States alone.
And those were the best case scenarios.
Mm-hmm. A silver lining on that is it has begun to influence our country's behavior, and some states and municipalities that had been resistant are now following advice that you were giving 2 weeks ago.
We are all coming to realize that this is going to be with us for a while yet, and that we have not yet even reached the peak of the disease process.
Right, and so the latest report is that 96% of Americans have been ordered to stay at home, which mirrors many of our friends in Asia and Europe.
Yep.
March ended as the worst month on Wall Street since 2008. And not surprisingly, U.S. jobless claims surged for a second week with at least 6.6 million people filing claims for unemployment benefits by the end of last week.
And that's the same worldwide where they're dealing with this pandemic.
It sure is. And to keep the World War II theme in, Wimbledon was canceled for the first time since World War II.
Yep.
On the other hand, there are some silver linings and some reasons for optimism. The race to understand, treat, and cure COVID-19 has created an unprecedented global scientific collaboration as nearly all other research has ground to a halt. This collaboration includes posting studies online long before they would normally appear, and researchers have identified and shared hundreds of viral genome sequences.
I agree. The collaboration has been fantastic. There is, however, I would like to raise a warning voice about this collaboration. Sometimes when articles are published and they've been through a peer review process and they're publishing them in preprint, meaning they're not waiting for the monthly issue to come out, that's very helpful. And we can look at that data and understand that it's been through the normal process. But a lot of articles are being published online and widely circulated, and they have not yet gone through a peer review process and have not yet actually been published.
And they should be helpful for you, not me at this point.
Right. I wish we could have a little better of a filter because a lot of these articles are influencing politicians, decision making, and some of that concerns me a little. We need to be careful about too widely sharing of this information or attaching too much significance to it because it's not yet actually seen the light of day scientifically. Some of the studies are also on very small populations of people, and we're drawing conclusions about what COVID-19 is doing in populations of millions of people from very small studies, and that's problematic. Don't allow yourself to hold on for dear life to a study that really doesn't have that much impact or significance yet.
And that does answer a little bit what I see occasionally in the comments are, have you seen this or have you seen that? And of course, you always have seen it when we discuss it, but we won't talk about it here
until it's vetted.
Right.
So we're trying as hard as we can, as much as I'd love to share every little factoid that's out there. We're trying to share those facts that are most relevant and those facts that we are most sure of.
Two contrasting notes to end this portion before we get to our questions is Washington State, of course, had our country's first coronavirus case, the first death, the first outbreak, but also was the first state to demand social distancing. And, it seems to be working there as we see a real flattening of the curve in Washington State that we aren't seeing in other places here.
That has been really impressive. Some folks have suggested, based on the data coming out of Washington State, that the R naught, which we talked about in previous episodes,
Right.
has been decreased because of social distancing, now down to influenza-like levels instead of the much higher COVID-19 levels that we were seeing previously through hand washing, social distancing, isolation, tracking and tracing of diseases.
Staying at home, all those things
Yep.
work. Unfortunately, on the opposite end of controlling our own destiny in the right way, a sad and cautionary tale came out over the weekend about 70 University of Texas at Austin students,
Yeah.
all in their 20s, chartered a plane from Austin to Mexico for spring break 2 weeks ago. They went against the advice of that time, which was much more lenient than it is right now, to avoid gathering in groups of more than 10 and non-essential air travel. Obviously did not watch our spring break episode where you made a passionate plea against this. But now 44 of those students have tested positive for coronavirus,
Yeah.
and then the circles emanating from those 44 is becoming
Yeah.
of great concern.
I feel bad for them because they're being talked a lot about.
Right.
But it should be noted that we're only talking about them because we did tests on them and figured this out. There were thousands of situations like these
Yeah.
all across the southern United States and in other parts of the world where people ignored counsel of public health officials. And I think we're finally getting the picture. Our hope is that it's not too late to impact that curve.
Well, and I agree. It is unfortunate for them to be held out because you're right. There are tens or hundreds of thousands who deserve the same scrutiny. But I will note it had an impact on my teenagers. I think that really helped click. Okay, I can't even be with one friend right now. We are going to be pure,
Yeah,
just jowers at home, and that's what
Good.
we're going to do for a couple of weeks.
I
So
love it.
Today, we're going to focus on pregnant and nursing mothers. A lot of
Okay.
questions about that. So the first question, does a pregnant mother need to take any additional precautions, or is she at an enhanced risk?
Yes, pregnant mothers are a population, in my mind, of concern. And because of the unique nature of pregnancy, I would feel that pregnant mothers do need to take extra precautions. And those extra precautions are just more carefully following the same sorts of things that we have suggested for the last 3 weeks, which is social distancing, limiting people coming over to your home to 0 if you can, while pregnant, and following the direction of your obstetrician or your family doc, whoever is taking care of you during pregnancy.
And you kind of answer this, but I'm going to ask it because it's an important question. What about the pregnant mother with children at home? And to put a finer point on that, you have said in previous episodes and in our discussions that children are typically particularly effective spreaders of a virus.
Yeah, I'm a pediatrician, so
Right.
I've been coughed on more than the average person. And so I would say that kids, for any viral disease, like a respiratory viral disease, are particularly efficient spreaders of it for several reasons. One, because of the nature of a child, we are close to them. Two, they can, we know from data, shed virus for longer and even have higher counts of virus in their secretions, even after their symptoms have resolved. So they can spread very efficiently. And three, children don't know how to cover their mouths, don't know how to cover their sneezes, like to touch everything
Right.
and put everything they can possibly find in their mouths, the younger they are, right?
Right.
So children are really efficient spreaders of infection. So the most important thing that pregnant mothers can do is to wash the hands of their children at home, wash their hands often, following guidelines or using hand sanitizer, and to make sure that things that kids normally put in their mouths, like toys if they're toddlers or utensils if they're older children, are cleaned regularly.
Final question about pregnant mothers is, because of these added concerns, should they move up in line to get tested if they have any of the symptoms?
A pregnant mother with symptoms should be tested, and I would call your healthcare provider if you have respiratory viral symptoms and figure out where to get tested no matter where you live in the world. My personal belief is that pregnant mothers should move up in line and get tested so that they can self-isolate or watch the pregnancy very carefully throughout their course of illness if they did have COVID-19.
Thank you. We now move to the mother that's had the child
Okay.
and is breastfeeding. And so a viewer asked, at this point, is it safer to use formula even if you have no symptoms and have been self-isolating?
No. If you're self-isolating and have no symptoms, breast milk is fine, and we would encourage you to continue breastfeeding your baby.
So let's take it a step further. Should a nursing mother who has respiratory viral symptoms or is positive for COVID-19 stop nursing?
That's a more nuanced answer because when you are COVID-19 positive, because of the very close contact required for breastfeeding, you're going to potentially infect your infant. And so I would recommend that if your symptoms are manageable, that you cover your mouth with a mask while breastfeeding your infant, and then wash your hands before and after touching your infant. However, if your symptoms are severe, if you have coughing that you cannot control, nasal secretions, sneezing, I would recommend that you express breast milk and have your partner feed the baby during this time frame and express that breast milk so that your breast milk supply stays adequate all through the illness. Because once the illness is over, we would still want this mom to continue breastfeeding.
Thanks as always for your guidance, and thanks as always for watching.